Hi, this is Dr. Alan Brackup. One of the most common questions I get asked by patients who come to the office to talk about injectable rejuvenation is, what is the difference between Botox, or now Dysport, and say Restylane or Juvederm? Well, they're totally different. There really are two categories of injectable fillers that we have to break down. The first are what are known as neurotoxins. You don't have to remember that name. But these are substances like Botox and Dysport that were developed initially for medical purposes. We used these substances back in the 80s, and I was part of the original trials to treat uncontrollable facial spasm. So patients would come in and they'd be blinking like this with something called blepharospasm, where the whole side of the face would be moving without their control in something called a hemifacial spasm. And I recall we would have a day every month or so, patients would come in literally from 8 hours around. They'd line up and we would do hundreds of injections of Botox for these people, and it was truly miraculous for them. It was a godsend. They loved us more for those injections than just about anything else we could do. Now along the way, someone figured out that, wait a minute, wrinkles get better when you inject Botox also. So that ushered in the entire cosmetic era of using Botox. We still use Botox to weaken muscles, but now we're weakening muscles that are causing objectionable lines. Frown lines here, crow's feet here. We can use it to raise the corners of the mouth. Sometimes we can use it to tighten the jawline or treat the bands of muscle here. We've found a whole new arena in which Botox has become extremely popular. So Botox weakens. It weakens muscles. That's how it works. Now, fillers plump, right? We inject fillers into the skin so they fill it out. So they do very different things. Sometimes we'll combine them. If the lines are really deep here, we'll use a filler and we'll use Botox. But areas like here, or cheeks, or the jawline, we'll absolutely use a filler in order to restore, to sculpt the face. Now when you combine the two in the best way, it is like a liquid facelift. Initially when we used filling materials, what we were doing was we were just treating individual lines. And then we figured out that wasn't the best way to do it. What we really need to do was to sculpt a face. I'll ask patients to bring in old photos so I could look at them from high school or college or intervening years to see what we're trying to go back to. And then by using these injectables, Botox, Juvederm, one of these materials, what we'll do is try and enhance their current appearance. I mean, it's not a facelift in the sense that we're pulling and tightening, but rather it's volumizing. Because as we age, one of the biggest things we lose is fullness. We lose volume. We get old, we get haggard, we sag. The skeletal look is an old look. Now, by the same token, we don't want to make you look like the Pillsbury Dough boy or girl. I mean, you don't want to have no features, and that's become the new horrible look. So what we want to do is we want to recreate you, but in a very, very natural way, by using this combination of the weakening materials like Botox and Dysport and the filling materials like Restylane and Juvederm.